This paper, published in the Journal of Women and Child Health by Oko et al., provides a rigorous epidemiological breakdown of intimate partner violence. The researchers anchored their study in Plateau State, located in north-central Nigeria. Globally, the World Health Organization estimates the baseline prevalence of intimate partner violence at roughly 30%. This macro baseline operates on the assumption of a uniform global distribution, but it fails to account for how local variables shift the probability of violence. Broad global data can smooth over regional realities, effectively masking the areas where severe socioeconomic divides cause risk factors to compound rapidly. These pre-existing regional vulnerabilities were exacerbated during post-COVID lockdowns, when extreme social isolation frequently trapped victims with their abusers. To actually combat intimate partner violence, we have to move past broad global averages and utilize highly precise, regionally stratified epidemiological data. To achieve that precision, the researchers utilized a massive dataset, the 2018 National Demographic and Health Survey. From this national dataset, they extracted a specific demographic focus, women of reproductive age, spanning 15 to 49 years old. Surveying this exact demographic across the entirety of Plateau State's vast 30,000 square kilometers requires an incredibly rigorous mathematical architecture. The researchers used a two-stage stratified cluster sampling technique, beginning by mapping the state's 17 distinct local government areas. In Stage 1, they generated thousands of specific enumeration nodes, 15,879 individual clusters spread across those local governments. Stage 2 is the stratification process. The clusters are separated based on population density, yielding 3,949 urban clusters and 11,930 rural clusters. From there, field workers utilized equal probability systematic sampling to select exactly 30 households per cluster. This precise sifting mechanism yielded a highly valid, representative dataset of respondents, ready for advanced SPSS analysis. This complex stratification architecture is necessary because it mathematically eliminates urban bias, uncovering the actual structural reality of the population. This chart shows the overall prevalence of intimate partner violence within the Plateau State sample. The data reveals a total prevalence rate of 62.6%. That is more than double the WHO's 30% global baseline established earlier. Deconstructing that figure, we find less severe physical violence at 15.8% and more severe physical violence at 7.9%. Sexual violence registers closely alongside, reported by 12.2%. But the overwhelmingly dominant driver of that top-line metric is emotional violence, reaching 58.3%. Lower educational achievement combined with non-professional work conditions creates a trap of financial dependency. The recurrence of this specific profile across age, geography, and income indicates that IPV in Plateau State is a predictable outcome of these structural pressures. Bivariate statistics give us an accurate profile, but they can only show correlation. They do not demonstrate which specific factors actually predict the violence. To filter out the noise and isolate the true risk multipliers, the authors applied a multivariate logistic regression. This model mathematically controls for confounding variables, like a subject's age or education level, allowing researchers to test the independent strength of a single factor. This chart is a forest plot. The vertical line represents an odds ratio of 1.0, the null line of no increased risk. The first significant predictor isolated is partner control issues, plotting right at an odds ratio of 2.67. Practically, controlling behaviors increase a woman's odds of experiencing violence by nearly 3 times. But the most powerful risk multiplier identified plots much further out: rural residents, with a massive odds ratio of 4.28. This means living in a rural cluster makes a woman over 4 times more likely to experience abuse than her urban counterpart, regardless of her age or education. This extreme rural multiplier is driven by a lack of socioeconomic infrastructure, combined with a higher adherence to traditional beliefs that enforce male dominance. By mathematically stripping away the confounders, the model proves that geography and partner psychology are highly distinct, powerful vectors of abuse. The regression model also maps protective factors, the variables that actively reduce vulnerability. Plotting household wealth reveals a significant protective effect. belonging to the middle or richer wealth quintiles lands far to the left of the null line, at an odds ratio of 0.25. Reaching those upper wealth brackets slashes the odds of experiencing intimate partner violence by 75%. This protective effect aligns with the bivariate finding that the vast majority of victims earn significantly less than their partners. Providing basic education and access to professional jobs gives women the leverage required to break the cycle of forced financial dependence. The epidemiological data demonstrates that a 62% prevalence rate cannot be solved by focusing on interpersonal behavior alone. The authors recommend highly targeted, multifaceted interventions that prioritize rural economic empowerment and systemic social awareness. Intimate partner violence in Plateau State is a mathematically predictable outcome of localized socioeconomic suppression.